Welcome to the third video of this 10-part series about metacognitive therapy. Today we continue expanding on our awareness and understanding of the thought processes behind MCT. We already covered trigger thoughts in the last video, and today we move on to metacognitive beliefs. These are the backbone of how we process and respond to our thoughts. You see, metacognitions are essentially our thoughts about thoughts. They're the beliefs and attitudes that we hold about our thinking process. Metacognitive beliefs are generalized beliefs about our thoughts and feelings, and they carry positive or negative information about how we should deal with our thoughts and feelings. Remember the trigger thoughts that we talked about in the last video? Well, our metacognitive beliefs play a crucial role in how we respond to these initial thoughts. For example, if your metacognitive belief is that you must control all thoughts to avoid anxiety, these simple trigger thoughts can spiral into excessive worrying and rumination. There are two main types of metacognitive beliefs: positive and negative ones. Understanding these is crucial as they profoundly influence how we engage with our thoughts and emotions. Positive metacognitive beliefs relate to the perceived benefits of engaging in certain thought processes. For example, someone might believe that worrying helps them be prepared for future problems. They might think that if I worry about an upcoming job interview, then I'm more likely to perform well because I've considered all the different possibilities of how the interview could go. Now, while this belief may seem helpful at first, it can lead to excessive worrying. The belief that thinking ahead can prevent negative outcomes can lead to a constant state of anxiety. So if we take worrying as an example, some of the most common positive metacognitive beliefs are that worry helps me be prepared, worrying helps me solve problems, or worrying keeps me in control of a situation. On the flip side, negative metacognitive beliefs are about our inability to control thoughts and the dangers of thinking certain ways. For example, someone might think that once I start worrying, I can't stop and it'll only keep getting worse. This can lead to a feeling of helplessness, and it can lead us to fear our own thoughts. This type of belief can be paralyzing. The fear that our own thoughts are uncontrollable or harmful can lead to a worsening of mental health issues like anxiety or depression. There's some common negative metacognitive beliefs that we see when it comes to worrying. These include things like, I have no control over the worry, my worries have taken control of my life, I've lost control over my thoughts, and if my worry continues, I'll lose my mind and go crazy. The underlying belief of all of these is that our thoughts are not within our control. But as we discussed in the last video, according to MCT, our thoughts are very much within our control. While we may not be able to control whether a thought strikes us, the initial trigger thought, we are always in control of what we do with the thoughts after that point. So both positive and negative metacognitive beliefs can be problematic. Positive beliefs focus on the usefulness of certain thought processes, even if they're maladaptive, while negative beliefs emphasize the uncontrollable and harmful nature of certain thoughts. It's also really important to note that it's completely normal to have both positive and negative beliefs. When our metacognitive beliefs are unhelpful, they can lead to or sustain psychological disorders like anxiety or depression. They're what makes us susceptible to prolonged worry or rumination after we've had that trigger thought we discussed in the last video. MCT aims to break this escalation of thoughts by modifying our core beliefs and thereby changing our relationship with our thoughts. So how do we change these deeply ingrained metacognitive beliefs? Through MCT techniques, we can learn to observe our thoughts without getting entangled in them. This reduces the impact of the metacognitive beliefs. Some of the techniques that we often use include detached mindfulness, attention training technique, or ATT for short, and worry postponement. We'll cover some of these in later videos of the series too. By understanding and modifying our metacognitions, we can significantly improve our mental well-being. It's not just about managing our thoughts, it's about changing our relationship with them. Metacognitive beliefs are central to what's known as Cognitive Attentional Syndrome. According to MCT, CAS are the strategies that we use to try to control our thoughts. Unfortunately, this can lead us to prolonged worrying, rumination, and threat monitoring, which can worsen our mental well-being and hold us in a cycle of distress. CAS is driven by these underlying metacognitive beliefs that we have. In the video next week, we're going to have a closer look at this concept of CAS, which is also a crucial element of MCT. Make sure you're subscribed and have the notifications turned on to not miss it. I upload new psychological insights, tips and tools on this channel every week. Let me know in the comments if there's a psychological topic you'd like me to cover in a future video. Thank you for watching this one, take care, and bye for now.